Hello and welcome to this SHAPE webinar, which is going to be about how you can look at your primary care planning within the SHAPE Place Atlas. If you haven't already, you can register for access to SHAPE Place via our homepage, and there's an online registration form that you can complete. So once you get your access, you can then log in to SHAPE Place, and it will look a little something like this, where you see a map of England. It's already selected Cambridge and Peterborough for me, but you can choose your STP or you can click directly on the map and it will take you to that area. So it works a bit like a Google map. You can zoom all the way in, an England level view down to further street level view. Now, SHAPE comes preloaded with all healthcare estate, and that does include the location of GP practices, including the branch practices, healthcare centres, secondary care services like hospitals, and also dentists and pharmacists. All this information comes from the Organisational Data Service, part of NHS Digital, and the data is updated monthly. And we try to reflect any changes or edits that we see. So I've selected GP practices. As you can see, there's number 38. That basically just means there are 38 sites really close together. And if I zoom in on one, you see that it shows me where they are on the map. If I hover over, it will tell me what they are. And I can just use this functionality to scroll in and out as I need to. At any point you can turn on other sites, so they're the health clinics or dentists here. So you can choose to see them, and then they will also come as a list here that you can export. So if I select one of our GPs, tells me this is Fenland Group, it comes with some information. First of which is about the catchment populations. So that is who is registered to that practice and which LOSA they live. So LOSA is the lower super output area. And we use that quite a bit in SHAPE as it's a low-level geography that allows us to understand what's going on in place. And if I just expand that, zoom in a little bit. So you can see there were 853 people live in this LOSA were registered to that GP practice, and only one person registered from this LOSA went to that GP practice. So it shows you the spread of where people who are registered to that GP practice actually live, and you can see other little pockets across the patch there. I can also show the practice submitted contractual boundary, and this is where the GP says it's going to take its patients from. This data was last updated in March, and we used the primary care web tool for that. As that's now been decommissioned, we are looking for other source of data about where we can get the contractual boundary from. So we will look to update that when that becomes available. But you can just use those little togs to turn that information on and off. Also of interest is looking at where patients, so what other GP practices patients in this LOSA might go to. So say, for example, this practice was going to close, maybe it was a single-handed practice. If I click on this LOSA, it shows me, well, what other practices do people come to? And actually, about 43% of people who live in this patch do actually go to that GP practice, but there are others that they go to. So 24% go to one of those practices there. So this is a sort of a proportional flow diagram of where people who live in this patch, what other practices they go to. So that might be useful. So to turn that off, I just click on that button. And that information about the population is also available in a population pyramid. And then we also have some information about the practice workforce. So again, for this GP practice, it gives me a breakdown of the number of GPs we have, and also their age band and the type, whether they're partners or salaried. We have that information similar for nursing, direct patient care, so that includes things like healthcare assistant dispensers, and also their administration staff. All this data comes from NHS Digital, and we provide the link to where that is. At the moment, it's considered experimental statistics, so we've just put that in at the moment to see what sort of information we can glean from it. Some new data that's just gone in is around the prescription activity, and what this will do, it will actually say, well, which pharmacy is in my network, and what pharmacy do my patients use to fulfill their prescriptions. And if I quickly just pop back to the sites list, I'm just going to hit that button that says with data overlay, and that will get rid of all those other pharmacies that we saw. So for this particular GP practice I've picked, these are the pharmacies that my registered population are using, and actually also gives me a list, and it says actually 15% of my patients using the Lloyd's pharmacy, which is probably that one over there. Yeah, and I can edit that if I only wanted to look at the top 10. Again, that comes from the NHS Business Service Authority, and at the bottom there you can get the link to where we get that data from. So again, I think that will be really useful for looking at your primary care networks and the relationships that you have between pharmacies and general practice. Just going back to the site list, I'm just going to turn all GPs back on again. Now, if I also wanted to create a network, the primary care network, so say for example this GP is in a network with that one, if I just select on the icon and then hit add, and maybe this one here too, and let's do this one here. It starts to, you kind of get this picture of the relationship between the PCN, so let's pretend these four are together in a PCN. And now I've got some information for that combined group of practices. So if I click on the combined registered patients, it will then actually do that catchment population, but for all the patients that are registered to those 4 practices that I've selected. And as you'd expect, that spread gets a little bit bigger. And again, I can still do the same thing about the practice submitted contractual boundary, but if I hit that all merged one, it will actually merge them for me. And you can sort of see the pattern. Actually, there's quite a good relationship between those who are registered and those that are contracted. It's probably likely there's a branch surgery out here, which is why we've got so many people in there. And then I can just edit that and turn that off again. And then to remove them, I can just hit deselect, and that will take them off the map again. And then I'm back to where I was just for that one site. So that's sort of about mapping the site data. And as always, we do have some indicator data. For example, we've got things about population density and age profile. If I want to map that data, I can click on that little icon which is show map as an internal indicator, and that will map for the whole area that I'm in, and I'm in it as a CCG at the moment, all the LOSAs and the portion of the population that's aged 0 to 4. The darker the colour, the higher the proportion, and that's our distribution chart there. This interpretation panel will give you an explanation of what the quintiles mean and also the source of the data. But if I pop back to the sites list and just scroll down, they're the list of the sites that I've got mapped, and in this case it's all GP practices, and it's also come with the value that the GP practice sits in. So if it sits in that LOSA, it will bring back the value of that LOSA for that practice, and that can be exported using that icon there. So this is really useful. So say you needed to find GP practices that were in areas that had a lot of your target group, such as young people or maybe higher areas of deprivation, you can use that functionality quite quickly to identify sites that might be in your target areas. So there's a range of other data that you can map. And also, if I quickly show you some of our layers data, we do have some that relates to primary care. Recently, we just uploaded some data about access to dental surgery. So this is the dental access rates per 1,000 population. And if I just use this new functionality as well, which is to emphasize the selected area. So if I want to get rid of the background noise, I can click on that button. And that will help me focus on my the Cambridgeish site that I'm in. And again, it's by LOSA. The lighter colours, a lower access rate, and the darker colours, a higher access rate. So that's the sort of information we have in the layers tab. So that's all I wanted to show you around what we can do in primary care mapping. There's lots of other functionality in Shape, and they will be picked up in future webinars.